Do you really need to start dialysis, or were you told it's still way too early? Because the truth many don't know is that some patients start dialysis early, while others delay it for far too long, unfortunately, until their bodies collapse. In this video, I'll explain when you need to start dialysis and when you might still have some time. I'm Dr. Osama Ibrahim, a specialist in nephrology and hemodialysis. Over 37 million people in America have kidney problems, and most feel no symptoms at first. That's the most dangerous thing about kidney disease. It's a silent illness with no symptoms. Meaning, you could reach a very advanced stage and sadly not feel any symptoms at all. You think you're perfectly fine. In this video, we'll cover 3 important things. First, we'll simply understand when dialysis actually needs to begin. Second, I'll tell you the signs that show you're nearing dialysis and what you can do to delay or avoid reaching that advanced stage. Let me simplify the matter for you. The kidney is essentially a filter. This filter works 24 hours a day, cleaning toxins from the blood and regulating excess fluids, expelling them through urine. It also regulates salts and minerals like calcium, phosphorus, and potassium, and helps manage blood pressure. When the kidneys start to weaken, toxins begin to build up, and unfortunately this doesn't happen suddenly. It happens gradually over time. And here we measure kidney efficiency using something called GFR. Simple numbers that show us the kidney's condition. So above 90 is normal, from 60 to 90, there's early weakness or kidney impairment, from 30 to 60 is moderate weakness. But if the ratio is 15 to 30, it's severe kidney weakness, and God forbid, less than 15% means kidney failure. If you've had a GFR recently, comment the number below and I'll give you vital advice to avoid everything we've discussed. But the most important thing to know is you can lose 70% of kidney function without feeling a thing. And that's what we explained in detail in a video about the early symptoms of kidney failure. I strongly recommend watching it after this one. I'll link it in the description or it'll appear in the iCard. It's very important to watch. Let's get to the big question. When do you need dialysis? Does every kidney patient actually need dialysis? The answer is no. Dialysis doesn't start based on a number. There's no specific number that dictates a patient must start dialysis. We begin dialysis when the body can no longer handle toxins and excess fluids. Let's briefly summarize the main symptoms that occur with impaired kidney function. Extreme fatigue and constant exhaustion without any extra physical effort. Shortness of breath and chest tightness, and sometimes the patient feels like they're drowning. Swelling in the hands, feet, or around the eyelids, especially when the patient wakes up in the morning. Loss of appetite and a bad taste in the mouth. Patients say food tastes like ammonia. The smell of food bothers them, they can't stand the scent of it. Frequent nausea can occur, along with poor concentration and mental confusion. All these are due to toxin buildup in the body, specifically urea, which the kidneys should filter. Now here's something important. There are critical conditions to worry about, like high potassium, because if it rises, God forbid, it can stop the heart. Also, excess fluid in the lungs makes breathing difficult or very high uncontrollable blood pressure. We also made a very important video about patients with kidney failure, kidney function, the danger of high potassium for them, and what foods they should avoid. This video is very important because high potassium is one of the most dangerous things that can, God forbid, stop the heart muscle. I advise you to watch it after this video. I'll leave the link in the video description or it will appear in the iCard here. Let's continue. In the cases we mentioned, dialysis becomes very necessary because it is life-saving. But that doesn't mean every patient, as we said in the GFR classification, who reaches 15 needs immediate dialysis. Many people can tolerate it, and unfortunately, some people's bodies cannot. And those danger signs we mentioned are what force us to resort to emergency dialysis immediately. But let me tell you something very important. Many people reach this stage when they actually had some early warning signs, meaning the body gives signals that the kidney's condition has started to deteriorate, but unfortunately they just didn't notice. Like, for example, foamy urine, which many people consider a simple thing. When they see bubbles in the urine, bubbles on the surface of the urine after using the bathroom, they think it's normal. And this could be a sign of protein leaking from the kidneys and that the kidney's condition has started to deteriorate. We made a very important and necessary video about foamy urine, how to know if it's something normal or a result of kidney impact. I'll leave the video link in the description or in the iCard. It's very important to watch it after this video. So why, doctor, do people delay? The truth is, I see this daily. A patient comes in saying, I'm very well, doctor. Then after we do some tests, we discover that the kidneys are in a very advanced stage, yet the patient isn't complaining of anything. So what are the reasons? There are no clear symptoms, neglecting diabetes, neglecting blood pressure medications. No periodic tests are being done. He wasn't feeling anything at all. And the kidney GFR was less than 15%. And as we said, this is often the result of daily habits, wrong foods that we eat. And I made a special video about daily foods we eat that destroy the kidneys. You'll find it in the video description or it will appear in the iCard. You need to watch it very urgently after this video because these are some of the most common mistakes we practice daily. Normally, natural foods we eat, and unfortunately, they destroy the kidneys. And here is the question everyone asks. Is it possible, doctor, to avoid kidney dialysis? The answer is yes, and in many cases, but in the presence of some factors, most importantly, blood pressure, meaning if your blood pressure is less than 130/80 and balanced while taking blood pressure meds, that's good. Diabetes, because diabetes is one of the most famous causes of kidney failure in America, high blood sugar levels in America. There are certain medications that protect the kidneys, especially if you have high blood pressure, to reduce protein leakage and thus reduce the load on the kidneys. Of course, diet, reducing salt and protein is essential. Painkillers, as we've agreed many times before, excessive use, especially the non-steroidal group, destroys the kidneys. What does that mean? It means even if you can't prevent dialysis, if you maintain all these things we mentioned, you can delay it. Of course, after reviewing the tests and consulting the doctor you're following up with to evaluate your full health status. But here we are simply talking about the basic factors. Let me give you 5 questions to discuss with the doctor. If the doctor tells you that you need kidney dialysis, ask him these 5 questions. First question, what is the GFR? Second, you should know if the level is dropping fast or stable. You must know if you have symptoms or if it's just numbers. Ask your doctor if you can wait. This decision is made by the doctor based on your health. Last question, what advice can I follow to delay it if possible? We've explained this before, like reducing protein and painkillers and managing blood pressure and sugar and everything we discussed. These questions could change a very important decision in your life. And let me ask you here, are you following up or are you waiting for symptoms to appear? Are you doing regular kidney function tests? Because be careful, if symptoms appear, you might be very close to needing dialysis. Finally, if this video helped you, share it with anyone who might benefit from the information. And don't forget, we made this video for you today with good intentions. I hope you also did something good today. Always keep it positive, like, share, and help others. See you next week to check on you and reassure you. Don't forget to watch these videos as they'll make a big difference for your kidney health. Be well.